what should be those things I should look for in a clinic from where I should get it done? What are those points which I must see before I get my procedure done?
Okay, so most of our queries, they come online, and online also most of the patients can see. The first thing they have to look out is the qualifications of the doctor.
Yes.
Please do not go to a clinic where the degree or of the doctor or the qualifications are not mentioned, and then
Sometimes even the name of the doctor is not
not
mentioned.
there. Yeah, so this is very important. Also, kindly look out for the accreditations. So there are genuine accreditation bodies or organizations or societies which are doing a great amount of work in the field of spreading the scientific knowledge, like ISHRS, our parent body, International Society of Hair Restoration Surgery. Then ABHRS is one of the toughest and the highest accreditation body world over, and their standards are set so high that hardly a few American board certified hair transplant surgeons are coming out every year, and it's a rigorous screening process which for the doctors who can apply, and then they have a rigorous theory, practical, and there is a special re-accreditation policy in few years. Every few years, like around a decade or so, you have to appear in those exams, and they just don't look at your knowledge; they look at your ethics also, and a lot of other factors.
So doctors who are ABHRS they are very good in their field.
It's a well-known fact, and ISHRS, and do look out for the qualifications. So a lot of people are doing hair transplant who should not be doing, whose primary training has not been in that field, totally unrelated field, and people are doing hair transplant. So this is qualifications and accreditation is the first thing. Second thing is the planning. How scientifically the planning has been made in your case when you go for the consultation. Did they do the trichoscopy to look out your terminal or vellus hairs? Did they do the calculation of your donor area, measured it accurately or not, or just looked at your scalp and said 2,500, 3,300 grafts?
So scientific long-term planning.
Those are the red flags, but it has to be, and yes, exactly. And the planning, long-term planning, whether you should be taking medical treatment, how long, these are the important point. A very important point, I think, is the doctor or the clinic discussing about the failures. What do they do in the cases of failure? And never go for a clinic transplant where they are giving you ironclad guarantees or giving you some 25-year guarantee. This is all absolutely wrong and unethical, and this is not like that. As we have discussed, there is no 100% guarantees for any.
So after all, hair transplant is also a kind of surgery. It's a procedure done over human beings. So absolutely, there are chances of not so good a result or wonderful result. So we always have to see the result.
Also, yeah, and apart from that, please do discuss the involvement of the doctor. So we are now hearing that the doctor was there for just 5 minutes, drew the line or something, and then was never to be seen during the procedure. So the doctor's involvement has to be there for a fairly good amount of time, rather than for a few minutes and then they are just off.
So we have to see for the ghost surgeries, like
yes, exactly.
The doctor was absent, somebody did the procedure, the patient never knew who did the procedure.
Absolutely.
So fight the fight on behalf of ISHRS and focus on behalf of AHRS. These are the two focus we have to fight the ghost surgeries. The doctor has to be there and he has to be in charge of your procedure.
Yes. Apart from that, transparency. How transparent the clinic is about the number of grafts. Did they show you the number of grafts on any counter, or they asked you to believe on what they said? So because the costing of the hair transplant goes per graft. Exactly. So these kind of transparencies. And the last important this thing is to check out the facility. What kind of accreditation is the facility and the team. If they are hiring a team on a day-to-day basis, that means the team is not involved in upgrading their skills.
This is so true.
Yeah. So a consistent, long-lasting team and doing follow-up for you after the procedure. These are the kind of things which you should look out.
Hand-holding after the procedure. The patient should be, they should be relaxed. They should know that there are people to take care. They have the phone numbers they can call anytime after the procedure.
And do not go with a single clinic. reach out to couple of 3 4 5 clinics, and then at the end, if you have checked out all these boxes, then in the end you have to go with the instinct. Whatever you feel is the best option for you, then accordingly you should go with the hair transplant with that clinic.